Hey everybody, this is Dr. Nick with the Springfield Wellness Center. This week's topic is going to be on inflammation. So inflammation can impact your body in a lot of different ways. Not only can it cause pain in your joints, pain in the muscles, but it can also affect your organs. A lot of heart disease issues are created by inflammation. They're even saying that Alzheimer's now is mainly a long-term exposure to excessive inflammation in the body. So we're going to talk about 3 different things in the office that we do to combat inflammation. So the first one is going to be our deep tissue laser. Now our deep tissue laser is going to be focusing on small individual areas of the body. So if someone has a sprained ankle, if somebody has carpal tunnel, if somebody has low back pain, we're able to use the laser to help stimulate the healing process in the body and help to speed it up. So there's a few different attachments that we have for the head. So this comes off and we'd be able to change this out. So this would be a good one for something like the neck with some small muscles. If we needed to get into bigger muscles, we'd add this larger ball on. And this is the one that we probably use the most, especially for low back and for spinal conditions. But then we also have a little bit more of a pinpoint attachment that has a smaller head and then something that's a little bit bigger. These would be great for dealing with an elbow problem or a shoulder problem or a wrist. And this gives us a little bit broader area to use as well. So the laser is actually a tool that we use. It works with light, so it actually penetrates into the cellular level and does the healing at that level, as opposed to something like ultrasound, which just it's on the superficial level and it heats up the tissue, and that's how it stimulates healing. So this is a really great way if you have a single area that is inflamed or is not healing properly. This is a great tool that we use along with the soft tissue techniques and the adjustments that we do to get things moving right. So we're going to go through the other 2 once we move over into the other room. So a second thing that I wanted to talk to you about when it comes to inflammation is how to avoid it in the first place. So one of the major components of inflammatory processes within the body is the diet. Refined sugars, carbohydrates that aren't fruits and vegetables, just like those unhealthy fried foods, those are the things that are really going to create inflammation within your body. So the way that you combat that is by not introducing those foods into your body in the first place. Well, a lot of people, that sounds great, but they don't know exactly what they should be and shouldn't be eating. So what we did for our patients is we actually created a program called Fresh 60, and it's an email that goes out to you once a week for 8 weeks. And each week you get a shopping list of all of the meals and snacks for that week. And then it gives you a day-by-day breakdown of 3 healthy meals and 2 healthy snacks. Now, because we're doing this video today for everybody out on Facebook, what we're gonna do is we're gonna offer the first week free to anyone who's not a patient. And if you become a patient, if you mention that you heard about Fresh 60 on Facebook, then we give that to you for free as being a member of the office. So make sure that you head over to our website, which is wellnessspringfield.com, and you can email us and let us know that you're interested in getting that 1 week free Fresh 60. And that, I think, will really help get you kick-started on a healthy diet to help decrease inflammation from the beginning. The last thing we're going to talk about today when it comes to inflammation is whole body inflammation. So people that are dealing with rheumatoid arthritis, with fibromyalgia, or just inflammation in general in multiple areas. We talked about the laser being a really good tool for pinpoint location for inflammation. This is our whole body cryosauna, and this is going to be great for whole body inflammation. So if you're trying to recover from a workout, if you have some kind of disease process like we talked about with whole body inflammation, this is going to be a really good thing. So what this is actually a whole body cryosauna, and it's a chamber that you would step into. You'd stand on the platform here, and your head and shoulders are up above the platform. As you can see, there's some liquid nitrogen that's been turned into gas that goes into the chamber. I'm going to run it real quick just so you can see it come out, and you can see how that gas gets blasted into the cryosauna. When we close that, it keeps it inside. Your body's all inside, and what it does is it exposes your skin to extreme cold. Now this lasts for about 2.5 to 3 minutes, gets down to about negative 150 degrees Fahrenheit, and what that does is there are sensors on on your skin that sense extreme cold. So if you're out in the middle of the wilderness and you get stranded in a blizzard, your skin sensors send an impulse to the brain saying that, hey, we're in danger, and it starts to bring the blood into the core. When it does that, it processes the blood through the heart, the lungs, the kidneys, and the liver. When it does that, it can help to clean out some of that inflammation. So when you step out of this, your skin sensors say, hey, everything's okay. Your brain sends signals back to the body saying that the blood can go back out to the extremities, and everything goes back to normal. Well, the blood that goes back out there has less inflammation, and it's been shown to decrease that whole body inflammation. So it helps with recovery. It also helps with symptoms relative to whole body inflammation processes. So if you want to find out more information about the cryosauna, head over to either wellnessspringfield.com or recoverspringfield.com, and you can find out more information there.
Extension of the spine will help bring oxygen. Hi, this is Nancy Thompson, your functional fitness specialist at the Springfield Wellness Center, wanting to discuss inflammation. We know excess inflammation can cause excess distress in our bodies. We know that too much stress, work, and over-processed foods, and too little rest and exercise and too little whole fresh foods can really cause inflammation in our bodies and cause a problem. But what is great is that we can choose. These are all lifestyle things that we can choose to improve. And in fact, probably the easiest and best thing you can do is to start on a regular moderate exercise program to reduce inflammation. What a lot of people know about exercise is that, yeah, it might help you feel better, it might improve your aerobic capacity, depending on what kind of exercise you're doing, improve your muscle strength, improve your resting heart rate, blood pressure, a lot of good things that are measurable that we know and people do exercise for. But what you may not realize is that it can reduce the inflammatory markers in your body as well. So just like heart rate, if you're a sedentary person, your resting heart rate is going to be pretty much higher than an active person. But when you exercise, it goes up, the heart rate, but then over time, with chronic exercise, your resting heart rate will be lower. Same thing with blood pressure. Typically, a sedentary person has a lower resting blood pressure that goes up through acute exercise and then comes down during chronic exercise. And over time, again, you have a better blood pressure level. But with inflammation, it really follows the same pattern. An active person might start with a lower inflammatory marker, and it goes up with an acute bout of exercise, but then over time, your inflammatory markers actually are lower. And what that means is reduced risk of chronic diseases, which is huge. So just like your other cardiovascular improvements that you'll see with exercise and with your muscle strength improvements you may see with exercise, inflammation is also going to be improved, and that really long term can be huge for a reduction in chronic diseases. So the best thing you could do is start exercising. So what's the best kind of exercise? Just like anything else, it's the kind you're going to keep doing. So find something you enjoy, but the best would be if you can try to combine what you enjoy and make sure it's daily of some variety of cardio exercise, and then maybe 2 to 3 days a week add in a resistance training exercise, because what that's going to do is improve your body composition. And reducing your body fat and improving your lean muscle mass has been shown to reduce chronic disease states, but specifically that reduction in body fat is going to also indirectly reduce inflammatory markers. And again, you're having an additional benefit of reduced inflammation from exercise. So just find something you enjoy doing and throw in some resistance training, and you're going to have improved inflammatory markers, improved health, and just feel better. This is Nancy Thompson, your functional fitness specialist, encouraging you to get out and move to reduce inflammation. If you found this information helpful, share it with someone, and have a great day.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.